The goal today will be to better understand informed consent in medicine, and there's two contexts in particular that we're going to be looking at. We're going to be looking at what does it mean to secure informed consent in a clinical setting where a physician is treating a patient, and what does it mean to secure informed consent in an experimental setting where researchers are conducting tests on test subjects. Now, there's going to be a lot of overlap in terms of what informed consent means in each of these contexts, but in the clinical setting, you might say that the primary goal is to treat the patient, to help the patient get better, to improve their health, whereas in the experimental setting, the primary goal is going to be directed more towards gaining knowledge, gaining an understanding of what sorts of treatments work and which sorts of treatments don't work. So because the goals are going to be a little bit different, again, the clinical setting is about healing and treatment, and the experimental setting is more about research and knowledge. What it means to secure informed consent in each of these cases is going to look a little bit different as well. Now, to better understand informed consent generally, I'm going to trace it back to the Nuremberg Code of 1947, which was written in direct response to the atrocities that were carried out by Nazi doctors. So in our last meeting, we talked a little bit about the experiments that Nazi doctors performed on human subjects, and the Nuremberg Code was written in response to those actions as a way of trying to protect the rights of test subjects. A simple way of thinking about it is the pursuit of medical knowledge is very important. It's what medicine depends on. Without research, we can't develop new treatments and we can't improve the ones that we already have. So research is essential. But the Nuremberg Code outlines various human rights that can't be violated in the pursuit of medical knowledge. In other words, the Nuremberg Code is going to restrict what we can and can't do in the pursuit of trying to develop better treatments or trying to better understand disease and so forth. So human rights are central to the Nuremberg Code, and you can't violate human rights in the pursuit of medical knowledge. Specifically, the Nuremberg Code is going to contain 10 principles that help guide ethical research conducted on human subjects, but at the very top, the first principle states, the voluntary consent of the human subject is absolutely essential. So when it comes to trying to regulate medical research and protect human rights in the process of conducting research, the very first principle that's listed in this code is you have to respect the voluntary participation, the voluntary consent of human test subjects. Informed consent, in other words, appears at the very top of the list when we're talking about how to respect human rights when conducting medical research. So again, we're going to be talking about informed consent in a clinical setting, and we're going to be talking about it in an experimental setting. The Nuremberg Code focuses on the experimental setting, but for simplicity, I'm going to start with the clinical setting and we're going to circle back around to the Nuremberg Code. So just to give you a basic idea of informed consent in either context, the basic idea is something like this. Patients or subjects should know and understand what they're getting into and should have a choice about whether or not to proceed. So whether you're dealing with a patient in a clinic or you're dealing with a test subject when you're conducting a medical experiment, either way, the patient or the subject should know what they're getting into and they should have a choice about whether or not they want to move forward. To better understand informed consent in the clinical setting, here's what Ronald Munson has to say. Munson writes, "For consent to be morally and legally meaningful, individuals must be competent to understand what they are told about their condition and capable of exercising judgment. They have to be provided with relevant information about their illness and the proposed treatment for it in an understandable form and allowed the opportunity to ask questions. They have to be given information about alternative treatments, including no treatment at all. And they have to be allowed the freedom to make a decision about their treatment without any sort of coercion." So just to talk through these four conditions a little bit, first looking at competence. When it came to our discussion of paternalism, we said that there are different ways of assessing competence. First, you can run a diagnostic test where you see, does the patient have a condition, a medical condition, that we know interferes with the ability to make clear-headed decisions? So for example, a head injury, that's something where we know somebody has a condition that's going to impede their ability to make decisions. Or if they're under the influence of various types of drugs or alcohol, we know that impedes the ability to make decisions. And so in these cases, the patient would fail the diagnostic test. In other words, they're diagnosed with something that we know interferes with their ability to make decisions. When that happens, based on some of the stuff we talked about previously, somebody else has to make decisions on behalf of the patient. So somebody has to step in, whether the doctor or some sort of proxy decision maker, to make decisions on behalf of the patient, at least until their own decision-making ability is restored. But even setting the diagnostic test aside, there was also the functional test, where we ask questions about, can the patient understand what they're being told? Can they retain that information? So when you explain what their medical condition is, will they remember it or do they forget it moments later? We need to look at whether the patient can assess pros and cons. Can they weigh and value different treatment options? So can they say, okay, well, this treatment option looks like the best choice for me because of reasons A, B, and C? Can they do that sort of critical thinking, that sort of reasoning? And finally, can they communicate about what they want? Do they have some means, whether spoken language, written language, sign language, whatever, can they communicate with physicians about what they want? If a patient fails the diagnostic test or if they fail the functional test in one of these four ways, then we know somebody else has to make decisions on behalf of the patient. And coming back to informed consent now, that means the patient doesn't satisfy the first condition here. So again, to get informed consent, for it to be morally and legally meaningful, the patient has to be competent. And so we've looked at here are various ways in which we can test the competence of the patient. If they fail those tests, then we can't get informed consent from them. And so somebody else is going to have to make decisions on the patient's behalf. Secondly, one of the responsibilities of physicians in the clinic is going to be to disclose information in an understandable form to patients regarding their treatment options and their health. Whatever their health condition is, the physician is going to have to explain that and make sure that the patient actually understands it. They're also going to have to explain about different treatment options, and they have to be given the chance to ask questions. So this second condition really deals with the informed side of informed consent, where you're not just explaining what the health condition is like and what its implications are, but you're also trying to give information about what treatment options are available, and you're explaining how the treatment is going to work, what the side effects are, how long the treatment is going to last, and those sorts of things. And relatedly, this third condition of informed consent says the physician has to give information about alternative treatments, and they have to include information about what would happen if no treatment is given at all. The reason for that is because if a physician just says, here's what your condition is, here's what the treatment is for it, and we're just going to do the treatment with no further explanation, then the patient isn't really given a choice. You have to give the patient a choice between treatment and no treatment at the very least. Otherwise, the physician is at risk of just imposing their own will on the patient. So if the physician thinks one particular course of treatment is the right thing to do here, that may be their own view, but they can't force the patient to go along with that. They have to let the patient decide for themselves what the patient wants to do. And this brings us to our fourth condition of securing informed consent in the clinic, where the patient has to be allowed to make a decision without being coerced. So again, the physician can't force patients to do things. The physician has to leave the choice open. At the very least, if you're dealing with a competent individual who can make their own choices, then the physician has to not only present all this information that's detailed in points 2 and 3, but has to make sure that the patient themselves is the one who's making the choice, and they're not being pressured into making a decision by the physician or by anybody else. Whatever treatment option is pursued, whether the patient gets treatment or not, that has to be the patient's choice. So condition 4 of informed consent really deals with the consent part, where the patient is the one choosing, the patient is the one consenting to the treatment, and the patient is not being manipulated or tricked or deceived or coerced or forced or whatever into getting a treatment. It has to be strictly their choice based on their own understanding, and they have to be given the opportunity to make sure they really understand not just their condition, but all the available treatment options, including no treatment. Now again, if a patient's not competent, that means we need to go to someone else to make the decision on behalf of the patient. And whoever else makes that decision on behalf of the patient, we're going to have to secure informed consent from that person. So if a very young child is not competent, they're not capable of making their own medical decisions, it's up to maybe their parent to make medical decisions on their behalf, but the physician will still have to get informed consent from the parent. So even if the patient is not competent, that doesn't mean you can skip these 4 requirements. You still have to secure informed consent from whomever it is that's making the decision on behalf of the patient. So a parent, for example, has to be informed with respect to the condition that the child is facing, the treatment options available. They have to be told about what would happen if the child doesn't receive treatment, and the physician can't pressure or force the parent to go along with whatever treatment the doctor thinks is best. The parent has to be the one making the choice. And so there's that discussion of paternalism in medicine when children are involved in a previous video. So again, informed consent, the basic idea is patients or subjects understand what they're getting into and they have a choice about whether or not to proceed. These 4 conditions that we just talked about explain how to secure informed consent in a clinical setting. An experimental setting is going to be a little bit different. For one thing, the goal of a medical experiment is not necessarily to treat test subjects. It's not necessarily to help them get better individually. It's to gain better knowledge, better understanding of what treatments work and which ones don't. And so already there's a different relationship that holds between a test subject and a researcher as opposed to a patient and a physician. There is some overlap, so researchers are ultimately trying to figure out ways to help their test subjects, but the experiment itself is not directed towards trying to help the patients themselves. It's about trying to further our knowledge, further our understanding, or develop certain kinds of technology or treatment. So already, this is a different kind of relationship that we're dealing with. That means securing informed consent is going to look a little bit different as well. You might think at the very least that a participant in a clinical trial should understand up front that the goal of the clinical trial is to test scientific hypotheses as opposed to treating individual patients. This is not a clinical setting, so the goals and the practices are going to look different. That being said, though, informed consent in an experimental setting, I'm going to suggest that it includes the 4 things that Munson listed, so these 4 conditions that you have to meet to get informed consent in a clinical setting. All of that is included in the experimental setting, but there's more requirements. There's more that researchers have to do in order to secure informed consent in an experimental setting. So there's more guidelines, more restrictions for getting informed consent in the experimental setting as opposed to the clinical setting. Now this gets us back to the Nuremberg Code, which gives us some details about what it means to secure informed consent in an experimental setting specifically. So the very first code of 10 that's listed in the Nuremberg Code says the voluntary consent of the human subject is absolutely essential. And then it goes on to explain this in further detail. So as it states, this means that the person involved should have a legal capacity to give consent. This is kind of our competence requirement. The subject should be situated so as to be able to exercise free power of choice without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion. So this is like condition 4 of informed consent in the clinical setting, where we said you can't force patients to participate, you can't force them to get treatment. This is saying you can't force patients to participate in clinical studies. You can't trick them into it. You can't coerce them or use any sort of deceit, fraud, whatever, to get them into your clinical study. And furthermore, the subject should have a sufficient knowledge and comprehension of the elements of the subject matter involved as to enable him to make an understanding and enlightened decision. So this resembles conditions 2 and 3 of informed consent in the clinical setting, where we said certain pieces of information have to be disclosed to the patient. The patient in the clinical setting has to understand not just their condition, but the treatment options involved. In the experimental setting, it's similar, but there's going to be more information that researchers have to disclose to test subjects. So as we unpack the Nuremberg Code here, it elaborates and says, this latter element of sufficient knowledge requires that before the acceptance of an affirmative decision by the experimental subject, there should be made known to him the nature, duration, purpose of the experiment, the method and means by which it is to be conducted, all inconveniences and hazards reasonably to be expected, and the effects upon his health or person which may possibly come from participating in the experiment. So just to break this down a little bit, regarding the nature of the experiment, researchers have to disclose to subjects that this is experimental in nature. This is not a confirmed treatment. That whatever treatment is being offered is not necessarily going to work. In fact, we might not have very good information at all about whether it's going to work. It might just be a hypothesis. In terms of the duration, how long is the experiment going to go on? How many doses is a patient going to have to receive of a particular treatment? How many years after the experiment is concluded is the subject going to have to follow up with researchers to test to see whether or not there were long-term effects or not? The purpose of the experiment, this is going to involve what is the experiment supposed to be accomplishing here? Are we supposed to be developing a new treatment for a condition that we couldn't treat before? Are we supposed to be developing a better treatment than one that we have available right now? So explaining what's the goal of this particular experiment. Researchers are going to have to explain that to test subjects. The method and means by which the experiment is conducted, this might involve disclosing whether or not a placebo is going to be used. So some experiments are designed in such a way that half of the experimental subjects get a placebo, a completely inert treatment that doesn't do anything for them, and half get the experimental treatment. If you're going to be using that sort of placebo, you have to let subjects know that there's a 50-50 shot whether they're going to get the experimental treatment or just something that's not going to help them at all. Alternatively, some experiments are going to be set up where you have the experimental treatment given to half the subjects and you have the best standard of care given to the other half, where the best standard of care is not a placebo, it's a treatment, it's the best treatment that we know of to treat this particular condition, but it's still different than the experimental treatment. So whether you're using a placebo or whether you're using the best standard of care, you have to disclose all of that information to any test subject. And the rest of this has to do with the effects that the treatment might have on the subject. So if the experimental treatment is expected to have certain side effects or long-term effects, you have to disclose all of that information to the subject before they agree to participate. If it's not known what the long-term effects are, you have to disclose that information as well. The point is, the subject has to know all this information before they even begin to participate in the clinical trial. So this just packs in a lot more information that researchers are going to have to disclose to test subjects, whereas in the clinical setting we had these 4 bullet points that we said, here's how you secure informed consent. In the experimental setting, there's just a lot more information that has to get explained to test subjects to make sure they really understand what they're getting into. And of course, they can't be forced to participate in any clinical trial. This brings us to the 9th principle of the Nuremberg Code, which says, during the course of the experiment, the human subject should be at liberty to bring the experiment to an end if he has reached the physical or mental state where continuation of the experiment seems to him to be impossible. In other words, subjects can walk away from an experiment at any point in time. If they judge that they can't continue for whatever reason, if they judge they don't want to continue for whatever reason, that's their right to walk away from the experiment. So the first principle that we just unpacked deals a lot with what it means to inform a test subject of what they're getting into. And the 9th principle makes it clear that the test subject should be given the right to walk away from the experiment whenever they want. Or to put it differently, the first principle of the Nuremberg Code really unpacks the informed part of informed consent, and the 9th deals more with the consent part of informed consent. I'm not really going to talk about the other 8 principles of the Nuremberg Code, but you should look at them. They really just deal with the conditions under which the experiment should be carried out, other ways in which human rights should be respected, but none of them deal quite as directly with informed consent. So again, the other 8 principles, numbers 2 through 8, and then principle 10, are going to tell us a lot about what it means to conduct an experiment in an ethically sound way, but since they don't pertain to informed consent as directly, I'm going to set them aside for this particular video. Now, just to recap, the basic idea with respect to informed consent, whether in the clinical setting or the experimental setting, the basic idea is to let patients or test subjects know what they're getting into, make sure they understand what they're getting into, and then give them a choice about whether or not to proceed, whether or not to continue treatment, or whether or not to continue participation in the experiment. In the clinical setting, we said patients have to be competent, they have to be given relevant information about their illness and treatment, as well as side effects in an understandable form. They have to be given the chance to ask questions from the physician. They also have to be told about alternative treatments, so what treatment options are available, and what would happen if I didn't get any treatment at all. Finally, they have to be given the free choice to decide what they want to do independent of coercion. So physicians can't force patients to get a particular course of treatment. They can't force patients to get treatment at all if patients refuse or say, I don't want to get treatment. If you fail to do any of these 4 conditions in the clinical setting, that means you failed to secure informed consent. So even if a patient willingly agrees to take a particular treatment, but they haven't been told all the relevant information about that treatment, even though they're doing this willingly, you haven't secured informed consent. Or if a patient willingly accepts a treatment and you haven't explained to them what would happen if they don't get that treatment, again, you've failed to secure informed consent. So you have to meet all 4 of these conditions in order to secure informed consent in the clinic. Then it looked like in the experimental setting, you've got these same 4 conditions, but there's a lot more added on to the process of securing informed consent. So when we looked at the first principle of the Nuremberg Code, it seemed like there were a lot of extra requirements where you had to explain the nature, duration, and so forth of the experiment. You have to explain that it is an experiment, that this is not a well-tested or well-known treatment. You have to explain whether or not you're going to be using a placebo at any point in time, whether half the patients are going to be getting a placebo or not. And the patient has to be given the right to walk away from the experiment if they deem it to be too hard to continue. So my suggestion as we move forward is look carefully at the 10 principles of the Nuremberg Code. I'll provide a link in the description below so that you can get to it quickly, but look carefully at those 10 principles. And in our next meeting, we're going to look a little bit at the history of experiments that were conducted in the US, and we'll be asking the question of how well did these experiments conform to the principles of the Nuremberg Code? Did they violate these principles or not? And this is going to matter because the Nuremberg Code is supposed to set up principles for how medical research is conducted in an ethical manner. It's giving an account of what it means to conduct medical research in a way that respects human rights. So if these are acceptable principles and we violate them, that means we're doing something very harmful to participants in the clinical trial. We might be violating their rights even. So we're going to get to that in the next meeting. For the time being, if you have any questions, concerns about informed consent, whether in the clinical setting or the experimental setting, and how this ties into the Nuremberg Code, let me know that and I'll get back to you.